Hello and welcome. My name is Heather Odden. I'm a physical therapist and I am part of staff education at Lifetime Care. In addition, I am on our COVID-19 incident command team. So I'm here to bring you some information regarding PPE practices while making home visits, as well as proper donning and doffing procedures. Before I get to that piece, I did want to point out to you that we do have a new folder that's available in our originals on your laptops. We have a COVID-19 information folder. As you can see here on your screen, there is quite a few pieces of different documents and information there for you. It is my job as part of the incident command team to weed through all the information we're getting from the system level and to make sure that you have everything that is the most up to date, which is why you will notice that you're getting a lot of information on a regular basis. But we've tried to take everything that is most up to date and most pertinent to home care and put it here in the COVID-19 folder. So know that you can look at that. Please make sure that if you choose to use it, that you update your originals folder. That can be done from home if you're on your VPN. So you just want to make sure that you do it at a time where you can leave it for a little bit because it will take a bit of time. So maybe in the morning when you're getting ready for your day, or in the evening, if you're cooking dinner, you can let it run until you decide to turn off your computer for the night. So it will be there for you, but as you can see, there's a lot of really great information in there, and that's everything that is most up to date. So we're taking things out and putting new things in as they become more current. I also want to encourage you to please make sure that you're in your email on a regular basis. This is the best way we can get information to you, and I know it sometimes feels like a lot all at once, but things are very fluid and very much changing with this whole situation, as I'm sure you've gathered. So please be in your emails. You'll be getting emails from us, from the agency, but we also have the daily briefings that come from the system each evening. Those you want to make sure that you read. They give you things that are updated, new things that are going into the employee toolkit. And also, they have some really nice ideas on self-care. They've been including a lot on that as well. And also, on your Rochester Regional Intranet home site, you do have an employee toolkit that is available. It's organized by tab, and there's a lot of information in there about everything COVID-19, from screening to managing exposures, to equipment, to patients and visitors. So you can also check that out as well. And what they're doing is, as they put new items in the employee toolkit, they usually date them, so you'll know what is more current. But I will encourage you to definitely look through that. And once again, we have taken information from that and put it into the COVID-19 originals folder. So those are the things that most apply to the home care setting. All right. Now, as you are most likely aware, we are now in the system. I'm just going to move my little thing up here a little bit to get it out of the way. We are following a universal masking procedure. So we are now wearing a medical mask with all of our patients. So we will be following certain guidelines in order to extend the use of those masks, and we're going to talk about that a little bit later. But I just wanted to make sure that as we go through these different documents, that you do understand that we are wearing masks with all of our patients. So stay tuned for further instruction on that reuse piece. All right. So this is mainly why we're here. We have our PPE practices for home visiting staff. This was a document that was put together and emailed to all Lifetime Care users on March 21st. So you will have already received it in your email, but we do have a system-wide educational initiative, and we wanted to make sure to take the time to go through this with everybody. So that's why we're here today. This is the document that I'm speaking of, and this once again would have been emailed out on the 21st from myself, but it is also found in the employee toolkit, and it is the home visiting staff for management of suspected or confirmed COVID-19 patients. So where we're starting here underneath my head here, my little camera, it says setting. So obviously for us, we are mainly working in the patient's home or possibly an assisted living facility as when we're making our home visits. So we're going to start right up here at the top of the document and go through that together. So the first section here, once again, our setting is in the patient's home or an assisted living facility. And you as a healthcare worker, if you are providing direct care to patients that are COVID-19 positive, will be wearing the following personal protective equipment. a medical mask, a gown, gloves, and eye protection. Now, this week, that eye protection went from being goggles to a face shield. We now have face shields that will be delivered to you in the next few days. They came from a local company. I believe it's called Century Mold, and Rochester Regional had them made for all of their healthcare professionals. So you will have that face shield. So you will be wearing all of those pieces, and the patient will be wearing a mask, obviously, if they can tolerate it. Now, when do we wear an N95 respirator? Well, according to the current guidance, you would wear an N95 respirator if you are performing an aerosol generating procedure with a COVID-19 positive patient. Okay, so that would be in the home setting, nebulizers, open trach suctioning. So those are types of aerosol generating procedures. And also this may apply to some of our hospice workers if you're with a patient at the very end of life, if they have some respiratory changes that involve a lot of secretions, you may also wear the N95 respirator. So once again, aerosol generating procedures, that is when we're wearing our N95 respirators, as well as a gown, gloves, and our eye protection, which now would either be the goggles, but most likely the face shield. And once again, depending on what you're doing with a patient, likely if you're doing an aerosol generating procedure, they're not able to wear a mask, but if possible, then you would have them do that. All right, what if I'm providing direct care to an asymptomatic patient with a family member that is positive for COVID-19 or under investigation for COVID-19? Well, then we would want to make sure that we're also wearing the PPE that you see listed here. So we have our medical mask, our gown, our gloves, and our eye protection, which now will be our face shields. Now, the important piece of this, though, is what you see on the bottom of my screen there. And it says to please ask the family member to isolate themselves in another room if possible. If they have to be present for the visit, then you would ask them to mask if they have a mask. And the important piece is that, they should be isolating themselves not only from the patient, but obviously from us as we're making the home visits. So you want to ask them to isolate themselves. If they have to be present, you can ask them to wear a mask. Hopefully that was provided from the hospital if they were in the hospital. So you would want to ask them to wear that if they have to be there, because sometimes they have to be there, whether it's for med teaching or wound care or something like that. But obviously if they're positive for COVID-19, I can't imagine they're feeling very well. So you would want to try to ask them to stay in another room. All right, now what if we have family members and caregivers that have to be present for the visit? Once again, we would want to be asking them to wear a mask. If the family member is positive, if the patient is COVID positive, if they've been in contact with anyone that's COVID-19 positive, or in contact with anyone that is under investigation for COVID-19. So those are situations where you would want to ask them to wear a mask. Now, what if we have a patient with respiratory symptoms, but it's not necessarily related to COVID-19? This could be a lot of our patients. We have people with heart failure. We have people with COPD. What about folks with seasonal allergies? I know mine have been acting up a lot. There's a lot of things, spring has sprung. So maybe they have respiratory symptoms, but they're not under investigation for COVID-19. They are not positive. They haven't had any sick contacts with anyone that's positive or under investigation. Then we would wear a mask and gloves, as you see there on the screen, and we would ask the patient to wear a mask as well. Those would be following our droplet precautions. Okay, now what if we have a family member that is on quarantine and is asymptomatic? So this is happening in the community. Maybe they were told by the Department of Health to be on quarantine, or maybe they were told by their doctor to be on quarantine. It just depends. If they have to be present at the time of visit, once again, we would like for them to not be, but in this situation, they're on quarantine, they're asymptomatic, we would want to make sure that we wear our mask and gloves while we are doing that visit. All right, so the next section that I wanted to take some time to go through was the proper donning and doffing sequence. This comes right from the CDC guidelines, and these were actually sent out to staff, gosh, it seems like almost a month ago now. It was around the week before we sent out the other information for PPE practices, so probably around the 13th or 14th of last month. But these are really important guidelines, and now that we're getting more patients on our caseload that are COVID positive or have or under investigation, we want to make sure that everybody knows how to put everything on correctly, and more importantly, how to take everything off correctly, because that can help to reduce the risk of any contamination. So let's go through those. Now, the type of PPE that we're going to be putting on and taking off is obviously going to vary according to the level of precautions required. So we just went through all of those, okay? But let's start with gowns. So we, as home care visitors, we have disposable gowns. Most of them are blue. But when you're putting on a gown, you just want to make sure that you completely cover your torso all the way from your neck to your knees. You want to have it wrap around you all the way, and you want to make sure that you tie it nice and tightly. Don't just leave it open. Just make sure that you're fastening it. If it's at the neck and back, do both. If it's just at the back or waist, just do that one. And the next thing you're going to put on would be your mask or respirator. So we already talked about the difference of when you would wear a mask, which is with all patients, versus an N95 respirator, which would be during those aerosol generating procedures. But you want to make sure when you're putting on your mask, whether it's a respirator or a regular surgical/medical mask, make sure that you secure the ties. Now, most of the masks we're getting from home care have the little loops that go behind your ear. So you just want to make sure that you get those loops behind your ear. And then you're going to be using the front of the mask and just secure it to your face. And then make sure that it is completely covering your chin as well, okay? And if you're using an N95 respirator, you want to don that according to the education you received at your fit testing, and make sure that you fit check it as well. All right, the next thing you're going to put on would be your goggles or your face shield. So once again, like I said, all Lifetime Care home health employees are going to be receiving a face shield in the next couple of days. So you just want to make sure that you're putting it over your eyes and it does go under your chin and adjusting it to fit. Now, how do you get it to adjust? Make sure that you watch the video. There is a video link in the employee toolkit. We also got it all via email this week, but it is in the employee toolkit under the safe equipment practices section. And obviously when you're using the face shield, just try to avoid holding the plastic part of it that goes over your face. That just helps to keep any, it's like putting on glasses. You know, you want to hold it by the parts that go behind your eyes, like with the goggles. It's just going to help to keep your fingerprints off of it, any smudging, things like that. Also keep it cleaner. And then last thing we're going to put on is our gloves. Now, obviously, if we have a gown on, we want to make sure that we layer those gloves over the wrist portion of our gown. That just makes sure that we have no exposed skin to risk any sort of contamination. All right, so we've got everything on. Now, how about making sure that we're taking it off correctly? And I'm blocking a little bit of this with my screen here, but you can see that the sequence in which you remove your PPE is super important. And why is that really important? Well, it's going to help us to eliminate the risk of contaminating your clothing, your skin, your mucous membranes with any potentially infectious materials, right? That's the last thing we want. Now, it's important to know that we are recommending, if possible, that you remove all of your PPE outside of the patient's home, okay? So what you want to do is when you call to make appointments with the patient or you're doing your scheduling, you want to call and tell them, you know, can you please have a trash receptacle available outside of the home? So whether it's in a garage or outside of the driveway, and just let them know that's where we're just going to throw out my, you know, the things I'm going to wear. If they live in an apartment, they could have a trash can right by the door as you leave. So you want to make sure that you're disposing of your PPE in the patient's trash. You don't want to be taking it home with you, obviously, okay? And when you're doing this process, I'm going to encourage you, please have your hand sanitizer at the ready, okay? Because if at any reason between the steps, if you feel like you contaminated your hands at all, you can wash them right away. And then you can also, you're going to be using it at the end as well. All right, so let's go through those different steps. And the first thing that you're going to be removing is going to be your gown and your gloves. Okay, so what you're going to do is you're going to grab the front of that gown and pull it away from you, right? So that those parts that you tied when you put it on before you saw your patient are going to rip and release. And then what you're going to do is, as you're pulling that gown away from you, you're going to start to roll it up in your hands. Now, mind you, still have your gloves on. And as you roll that gown up, the portion that was exposed to any potential contaminants is now rolled to the inside. Okay, so let's look at a picture of that. So here you see this healthcare professional pulls the gown forward and starts rolling, okay? So, and as you're rolling, the black part here on our picture represents the part of the gown that was against that healthcare professional, and they're rolling it up and tucking in the yellow portion, which was on the outside of the gown, so that it's inside out. And then as you get all the way down to your hands, you see in E, you're going to pull your hands out of the gloves so that the gloves go inside out, right? Because the inside of the glove is the clean portion. That's the portion that you washed your hands, put your hands in the gloves, so that is clean. So as you go through, you pull your hands out, you pull the other hand out, and then when you go to dispose of it, you want to make sure to always just grab by the inside of your gown, right? Because that's the clean portion. So you're going to take that and then throw it in the trash. So that's the gown and gloves. What about my goggles or my face shield? Well, obviously, the outside of either the goggles or the face shield is potentially contaminated. So you still have your, you want to make sure that you clean those, okay? Our face shields are removable, or excuse me, are reusable. Yes, they are removable, but they are reusable. And I, once again, will encourage you to watch the video that describes how to properly clean them. That is in the employee toolkit and also via an email that you got earlier this week. So you want to be able to make sure that you wipe them off. Now, if you're seeing a patient that is COVID-19 positive, you want to make sure that you use our micro-kill with bleach wipes, okay? Because our regular micro-kill wipes do not kill COVID-19, so you want to make sure you use a micro-kill with bleach wipes. That is what we have right now. We may be getting Cavi wipes or some other types of wipes with bleach that will kill COVID-19, but you want to make sure that that what you're using will kill COVID-19, so you're going to wipe that off. And you, otherwise, if you're just seeing another patient with your face shield on, you can use our regular micro-kill wipes or alcohol props. All right, and then the last thing we're going to take off is our mask or the respirator. So once again, the front of it is potentially contaminated, so you want to just grab it by the ear loops and bring it forward and just fold it so that it's the outside is folded in, and then you're going to be throwing that away. Now, we are, once again, going to talk about in just a second about reuse of masks. If you're working with a patient that is COVID-19 positive or under investigation, you will not rewear that mask. If you're using a respirator, you will use that again, okay? And that has to do with some of the respirator reuse guidelines, which can be found in the employee toolkit. If you have any specific questions about that, feel free to reach out to me and I can help you find that information, okay? And then obviously you're gonna throw it out. Now, if for any reason you feel like your hands are contaminated in the process, you're going to be washing them. But obviously, after you finish taking everything off and it's all thrown in the trash, you want to do your hand hygiene. Most folks will be in a garage or maybe outside of a door at the, the door of the apartment. So you're not going to be able to use, obviously, soap and water. So you can use your hand sanitizer and use that to do your hand hygiene as you take everything, after you take everything off. All right, so like I said, just to reiterate, our micro-kill wipes, the ones that do kill COVID-19 are the ones that have bleach in them. So if you need any more, just make sure you contact, the way you normally would get supplies, okay? And we are obviously in the process of ordering more, so if you need more, just let us know. All right. So now I'm sure everyone's heard that all over, not even in the city, but the state and the country, that PPE is unfortunately not in huge surplus. So we are in a situation where we want to be very good stewards of using our personal protective equipment. And we are being instructed in how to really extend the life of our masks. So a couple of things I wanted to point out here is before you go to put on your mask, you want to make sure that you perform your hand hygiene, right? So that your hands are clean, so that you're not contaminating the mask. And our advice is that you put on the mask before you visit your first patient and you leave it there until you go to your last patient or finish up with your last patient. And the reason being, every time you take it on and put it off, you're risking contamination. It causes wear and tear on the mask. So it's really important that you want to try to just put it on in the place that it's supposed to be and just leave it there until you need to take it off at the end of making your visits. And obviously during the day, and this is one of the reasons that the mask is helpful is that you want to avoid touching it, right? Because we want to avoid touching any of our mucous membranes on our face, but avoid touching the mask. And our policy now is that, or our guidance is that we are going to be wearing that mask until it either becomes wet, visibly soiled, or damaged. Okay, so for some people, that might take a week for any of those three things to happen. For others, maybe they go through them a little bit quicker. So just know that we are asking you to wear that mask if it becomes wet, visibly soiled, or damaged. Now, when you go to take it off, we just talked about that a little bit, but just make sure that your hands are clean, you only touch those ear loops, and then obviously look at your mask. Is it soiled? Is it damaged? And what we'd like you to do is everyone will be provided with a paper bag. Store your mask in the paper bag so that it can air out. The paper bag will allow a bit of an airflow because obviously as we breathe, we have moisture in our breath. So that will help to allow for it to dry after we're done wearing it for the day, and it will be ready for us the next day. Now, and as far as ordering masks through Lifetime Care, I just sent out an email to everyone yesterday. We now have what we're calling a distribution coordinator. We have one person that all mask orders go through for Lifetime Care, and her name is Erica Andressi. So take a look at that email that I sent yesterday. That is the person that you will be getting your masks from. All other equipment will go through the normal channels that you would have ordered them prior. But if you work out of the Rochester office, you will be calling Erica Andressi. And if you work out of any of our branch offices, and I'm just talking about masks, then you will be calling Amber Grebner. Okay, so this is all in an email that was sent yesterday. So please refer to that and take time to read it. Now, like I said, masks can be worn for up to a week if they're not soiled, damaged, or wet. So just to reiterate that piece as well. All right. So if you have any questions, I will encourage you. Obviously, you can't type in here as I have on the slide, but any questions, please feel free to reach out to your manager or reach out directly to me. Once again, my name is Heather Odden. I'm with Staff Education. But if you would like any more information, please let us know. And we appreciate everything you're doing to take care of our patients and to help us get through this situation. Know that things change sometimes on a daily basis. So please do your best to keep up with the information and know that we're bringing to you everything that is the latest and most up-to-date and current information. So thank you everyone for everything you're doing and taking such great care of our patients. And I am so proud to be part of the workforce and to have such a great group of colleagues. So thank you everyone, and I appreciate your time today. Please let your manager know that you viewed this video, and take care.